Thank you, Kavita ma'am, for introducing me. I take this opportunity to thank the IDEC team, Rajiv sir, to give this opportunity to talk on a topic in which I have contributed in my own way, which I would be sharing in my slides also. Initially, I was given the topic of evidence-based nutrition therapy in management of diabetes, but I've added this word lifestyle also over here, because I feel that when you talk about management of diabetes, only nutrition therapy is not going to help, and lifestyle modification is equally vital over here. I may sound more of a teacher in my presentation because I have many students who are sitting over here and they are listening to me. I would also try that you identify gaps and get motivated to do really some good research, which is again a dream of our Dean Sir, Rajiv Sir, to really enter in some hardcore research areas. So I start my presentation seeking the blessings of Lord Ganesha, who in Indian mythology is known as the god of wisdom, remover of obstacles, and also very closely related to diabetes because of his legendary love for sweets as well as his characteristic pot belly, and this would make him maybe the most earliest known diabetic case in history. Nevertheless, may his blessings always be with us and we lead a very happy and healthy life. So, next. So diabetes is a chronic condition that occurs when the body cannot produce enough insulin or cannot effectively use the insulin it does produce. These days we also hear the term pre-diabetics, and it indicates a higher risk of developing type 2 diabetes and related complications. Next. Diabetes can be broadly classified as type 1, type 2, and gestational diabetes. I'm not going into the exact definitions, but the good part about type 2 diabetes is that it can be prevented or delayed, and there is accumulating evidence now that remission of this condition may sometimes be possible, and I will be showing some evidence in my coming slides as well. Next slide. So, the screening and the diagnostic tests, they include the measurement of the A1C levels, the fasting plasma glucose, and the 2-hour plasma glucose during the 75 grams OGTT test. And again, yes, these are given by the American Diabetes Association, the diagnostic and the screening criteria. Next. So why we are talking about diabetes? We know that people living with diabetes, it is increasing exponentially day to day. And if you see at the latest report of IDF Diabetes Atlas, their 10th edition, they have done the projections of the rise in the numbers from year 2021 to 2045, and it is going to almost range between 13% in Europe to about 134% in Africa. And it is very disheartening, next slide, it is very disheartening to see, next click, that the top 3 countries having adult population with diabetes, they fall into the Asian continent. And it's a high time that we really start thinking. We are doing things, but this makes management of diabetes as well as prevention of diabetes the core area. Next slide. So when we talk about management, the A, B, C, D, and E of management, they hold the key, where we are going to talk, where we have to have a look at our A1C levels, the blood pressure, cholesterol levels, and the emphasis on lifestyle modification with a focus on diet and the physical activity. So the goals of care or management, they have to prevent the complications related to diabetes and also optimizing the quality of life of people who are living with diabetes. And so any management plan which is being designed, it has to be smart enough in terms of specific, measurable, achievable, realistic, and of course time limited because we want to optimize that the diabetic people are living a healthy and a happy life as well. So what are the goals for nutrition therapy? Promoting and supporting healthy food eating patterns, emphasizing a variety of nutrient-dense foods in appropriate proportion sizes, and this is basically to achieve ideal body weight goals, attain our individual glycemic, blood pressure, lipid goals, and delaying the complications of diabetes. Very important here is to address the individual nutrient needs. So one diet plan doesn't suit all. We have been studying about nutrition therapy, we know about nutrition sciences, so we know this also, that there's a lot of diversity among the food that people eat. So there is no one single plan which is going to suit all, and to address individual nutrition needs is very important, and this should be done on the basis of the personal cultural preferences. Health literacy is very important, accessibility to these healthy foods, and also the willingness and ability to make behavioral changes. And I will go one step ahead, adherence to these behavioral changes is equally important. Maintaining the pleasure of eating. There is a lot of stigma attached to a diet where there are a lot of restrictions. And actually people lose the pleasure of eating food. So by providing the right food choices, the right messages pertaining to the meals which should be designed for the diabetic patients, the pleasure of eating should always be retained. And to provide practical tools for developing healthy eating patterns rather than just focusing on individual nutrients in terms of macronutrients or micronutrients or a single food. You cannot isolate food or a nutrient and just focus on one as a part of the management therapy. So I have picked up this table from a paper which is from the Indian perspective, and they have compared the recommendations of nutrition therapy based on the evidence which is available by three of the important working bodies on diabetes, which is the RSSDI, the ADA, and ICMR, and it's a must read for all the students, especially. A beautiful paper where the comparison has brought up. And taking this ahead, the content of the paper ahead, the evidence-based nutrition recommendations which have been laid for the management of diabetes, they include, of course, reducing intake of refined foods, total fat, restricting the intake of the total fat with an emphasis on the calories being contributed by saturated fatty acids, increasing the intake of fiber-rich foods, the protein content, the contribution of calories from proteins, as well as the intake of dietary fiber also has to be emphasized, restricting the intake of sucrose and also the non-nutritive sweeteners which are very readily used as substitutes to sugar while many of the diet or menu plans are prescribed. So that needs to be taken care of. Adopting regulated daily meal plans comprising of low glycemic index carbohydrates. So actually looking at what is the percentage of carbohydrate contribution in each meal is also of equal importance. And fortification can be one of the technique where the cereal flours, they can be fortified with either soluble viscous fiber or the legume flour. So this is one of the study that my MSc students had undertaken, and here we had tried to attempt that when we say that dietary diversity is there and from all the food groups the meal should be planned, that there should be a contribution, we tried to evaluate the food consumption pattern among the type 2 diabetic subjects, and we observed that only 30% of the participants, they were following a diet which was either given by a doctor or a dietitian. Rest of them felt that they are capable enough of deciding what they can eat, though they were suffering from type 2 diabetes. And when we saw the contribution of various macronutrients, carbohydrates contributed to 76% of the total calories, proteins 11%, and fats to 13%. The comparison with the ICMR recommendations showed that the participants, they were consuming carbohydrates 15 to 20% more, and proteins and fats were being consumed about 5 to 7% less as per the recommendation. And this emphasizes the need to plan and advocate appropriate diet plans to meet the recommended nutrient requirements for especially the T2DM patients. So there is evidence to show that why a single macronutrient or micronutrient should not be focused. Rather, it should be a whole diversified approach which should be adopted. So this slide, it shows some of the evidence regarding the nutrition therapy, and there is evidence to show that nutrition therapy recommendations do bring a reduction in the A1C values, but no ideal percentage of micronutrients have been, or the macronutrients have been identified, and a variety of eating patterns have shown to be effective for persons who are living with diabetes. Similarly, another meta-analysis, we talked about the food groups in the dietary prevention of type 2 diabetes. It showed that there is an inverse association between consumption of fresh fruits and vegetables, whole grains, nuts, and the risk of T2DM. Similarly, there are some foods which tend to increase the risk of type 2 diabetes. However, no individual nutrients but a diverse dietary pattern showed to contribute to the healthy lifestyle and also towards the T2DM prevention. And similarly, in one of the recent interesting paper which showed the comparative efficacy of different eating patterns in the management of diabetes, showed that calorie restriction was ranked as one of the best pattern for weight loss and reducing the waist circumference. And similarly, different types of dietary patterns were listed, but somehow they focused in the reduction of only one or two particular components related to the management of diabetes, and a holistic advantage of these patterns was not seen. So, I'm very happy to share that my PhD student, we are working on one of the doctoral theses where we want to see the efficacy of two specific meal plans, that is the continuous calorie restricted versus the time restricted intermittent fasting pattern. And it is going to be a randomized crossover clinical trial, where randomly the participants will be assigned to one of the two dietary interventions with a washout period, and then they will be taking the other intervention. And the primary objective is to see the efficacy of these diet patterns on the glycemic variability using the continuous glycemic measurement device, and I'm very happy to say that we have already registered this trial with the Clinical Trial Registry of India, and we have started with the enrollment of the subjects for this study. Also happy to share that we had starlets like Yajnik sir, Sanjay Gandhi sir as the review members, and we got very important insights from them to frame a really good protocol, looking ahead for some very promising results from this study. And when I talk about that remission of type 2 diabetes is possible, so why we really go for a nutrition therapy? Because our ultimate goal is to manage disease and also to take back these diabetic subjects to lead a normal life. So there is evidence which talks about that remission is possible. This is a very recent study by Salis et al., and we are very fortunate we are going to hear her in the afternoon sessions. She is going to be personally over here. And in this particular paper also, it was seen that there were various types of diet protocols or therapies which were adopted, and the ones who were following the low-calorie diets and the low-carbohydrate diets, they were able to achieve the remission of their diabetes, although this was in a targeted population in a clinical setting. And there was a constraint that the sustainability of this remission was not very long. It was only for 2 years, which calls upon a longitudinal approach or a long-term approach if you really want to achieve this. And so, adherence is the key. Next slide. And when I say that a long-term approach has to be adopted, adherence is the key, because you don't want to lose the motivation of the patients or the subjects in between. They have to be a part of that management plan for a long period of time to sustain the results that they are getting. So these particular systematic review conducted in 2020, it talked about adhering to a healthy lifestyle. So it doesn't only consider the nutrition therapy, but also along with favorable diet, you have physical activity, lifestyle modification in terms of non-smoking, moderate alcohol intake, and achieving normal weight. All of these were associated with a reduced risk of type 2 diabetes, and also the mortality cases, the relative mortality which was related to these complications. Another systematic review which was conducted in the low and middle income countries, it was seen that adherence rate for self-care behaviors, they differed for each component of the management strategy. That is diet, medication, exercise, self-monitoring of the blood glucose levels, and also the foot care. And so it is very important that the countries, they monitor the adherence to the individual diabetes care components rather than looking at a very cumulative adherence. Thus, joint adherence to healthy lifestyle along with diet with healthy lifestyle factors is important to prevent and manage type 2 diabetes and improve the survival among the individuals with diabetes. Again, a piece of information, a study coming from SIHS, where I and my PhD student, we tried to understand that what are the adherence and the barriers to the MNT, which is being given to the diabetic patients to control their glycemic profile. And not going into the detail, but it was disheartening to see that the adherence level was only 41.6%, even though that each of these subjects were with a registered dietitian, but the adherence was quite low. And also, like, there were improvements in the glycemic profile in the group, adhering group towards the MNT advised. And the major reasons or the motivating factors that they quoted were to improve the overall health, to control their blood sugar levels. And the barriers, the common barriers which were identified were that there was a lot of monotony or habituality to the food that they were eating every day. It does not satisfy their hunger, and there was lack of willpower. So motivation is very important, that these subjects, they stick to the advice that have been given to them. And that is why it shows that we concluded that MNT advice when RD is effective in reducing the barriers and also improves the adherence and gives a good control on the glycemic profile of the subjects.
Can you sum up, please? We run out of time.
Yes, sir. Just 2 more minutes. Next slide. So as I told, I'm done with my nutrition therapy content, but as I told that you cannot talk about nutrition therapy in isolation. So we have two more important components which form the core of the management plan. I will not go into the details, but physical activity is something that has to be focused, and 150 minutes or more of moderate to vigorous physical activity is needed with no more than 2 consecutive days without an activity. And prolonged sitting should be interrupted every 30 minutes for the blood glucose benefits. So all of us who have been sitting in this room for a long time now, I think we should move our bodies, because more than 30 minutes is going to be harmful for our glycemic profile. And of course, yoga, Surya Namaskar, they have shown beneficial effects. Again, a systematic review shows that supervised trainings increases the adherence to all the interventions which involve physical activity as one of the management strategy. So supervision again is re-emphasized over here. Similarly, Girja ma'am has already talked about psychosocial health. This is very important because systematic review evidence has shown that the QOL, the quality of life of diabetic patients, is found to be lower as compared to the normal population, and that is why it should be integrated with a very patient-centric approach to optimize the goals of the management for type 2 diabetes. And just happy to share that the SIHS group has also conducted one of the study where we looked at the quality of life among people with diabetes, dividing them into two groups based on their duration of diabetes. And the results showed that females had poor quality of life scores in physical functioning domain, emotional well-being domain, and social functioning domain. And thus, this should become one of the important targets in the diabetes management. And I just sum up my presentation that it is possible to live a healthy life even with diabetes if we have the right synchronization between all the components which form the core of a management plan. Thank you.